All right, everyone, we are going to mark up our patient here. We're giving her just some pretty standard Botox across the frontalis, the glabella. We're going to be treating her crow's feet and then also giving her a brow lift as well. So I'm going to walk you through the process of me marking her up. The first thing I always do is ask them to raise their eyebrows. This is activating her frontalis, and the reason I'm doing this is I want to see the lateral borders of her frontalis relax and then lift again. You can see here as she's creasing and then it stops. This is the lateral border of her frontalis. And it's really important to identify that so that we know how far to treat laterally. Otherwise, if we were to leave these lateral fibers untreated, relax for me, she would get that crazy Spock eyebrow. So those fibers remaining active on the frontalis untreated she'll start recruiting and pulling up. She'll have a really crazy Spock when she activates her frontalis. So this sort of gives me a visual. I know I have to treat all the way across to avoid that Spock brow. Okay, raise again for me. And now I am just going across her frontalis and sort of evenly placing my dots. Your product's going to diffuse about nickel to dime size. And we want to make sure we have just nice equal distribution of product across the frontalis. So you can see I have my marking sort of spaced out, just to allow that diffusion of product. Once it diffuses, everything's going to look nice and natural. Make an angry look for me. And I'm marking here the tails of her corrugator. You can see this sort of dimpling here. And this is the lateral aspect of our corrugator relax that becomes superficial and inserts into that tissue. And we never want to treat beyond that because instead you'll actually be back into the frontalis. You'll be out of the corrugator. And so you ask them to make that angry look, and then you can sort of pinch up that corrugator muscle and ensure that your medial and lateral doses are within the actual corrugator itself. So when we're marking up the crow's feet, obviously there's a lot of vascularity that we can see around the eye. There's also a lot of vascularity that we cannot see, and we obviously do our best to avoid those vessels at all costs. But I always tell patients sometimes there's vessels that I'm not able to see, and so we do our best to avoid that, to avoid any bruising. You can see there's a vessel here, which obviously I'm going to try and avoid. I'm palpating for her orbital rim so that I can mark my injection points about 1 centimeter from that orbital rim. Give us a really cheesy smile. Good. So, and I'm just sort of marking accordingly, following that muscle. Okay. And again, cheesy smile. Good. And relax. And close your eyes really tight for us. So the superior lateral aspect of that brow is actually a depressor muscle. So when she closes, you can see that muscle pulling down. Relax. And we're going to give her an injection there to try and give her a little bit of a lift in the brow as well. Okay. So that looks pretty good. We're going to go ahead and start our injections here. All right, we're going to proceed with our injections here. Again, we're going to avoid any vessels that we might see. And I'm just giving my neurotoxin directly into the muscle here. Turn towards me a little bit. You doing okay?
Mm-hmm.
So we're using our Comfortox needles here. These are nice and sharp. Keeps it very comfortable for the patient. I like to use 1 needle per injection site. So you'll notice I'm going to switch needles as I move down to my glabella. And that just ensures that I have a nice sharp needle. Dull needles don't feel very good in the face. So we like to keep it nice and sharp so that it's most comfortable for her. So now we're going to move down to the glabella, which is responsible for creating those 11 lines. And it's really important here that you use good technique to help prevent any potential complications like lid ptosis that can occur when you're treating this area. And basically that just involves, using your thumb or forefinger to block off your orbit so that you don't risk product migrating down into the lid. You can see as I wipe away my injection points, I'm always wiping up and away from the eye. You never want to bring that product down towards the eye. Thank you. So especially when we're providing our post-op instructions, we, no hats, no headbands, don't touch the forehead. We don't want to take a chance that we're going to move that product anywhere close to the eye. And you can see here she got a little bruise. Our first injection point. She can put ice on that tonight. We don't like her to touch the treatment area for the first 4 hours because, again, we don't want that product to migrate anywhere. After 4 hours, she can apply ice. She can take arnica. She did mention she forgot to stop her fish oils, which could be why she experienced some bruising. Unfortunately, anytime we put a needle to the face, there's always a chance of bruising. Okay, so we have 2 more injections here, and it's the brow lift. So I always like to have them activate that muscle again. So close your eyes real tight for me. Good, and relax. Very, very superficial injection. And turn this one. And again, close tight, relax. Really superficial. That's it. Thanks for watching.